So, ma'am, as you have told me that in 23 years you started your practice. It's around now a 27-year-old clinic. Any employee who is there from the starting to till date with you, ma'am?
No, only the one who cleans my clinic, the one who
Ah,
used to come previously.
ah.
Unluckily, she expired. So
Oh,
the
okay.
that auntie who comes to me for cleaning is coming to me since last maybe 23 years. First 3-4 years,
Awesome.
another lady was there. That
Oh,
sweeper lady is
awesome.
there since last 23 years. I have one girl who comes to me since 2010, 2011. I have at least three employees who come to me since more than 10 years.
Oh wow, ma'am, that's
So,
actually a thing which we never see nowadays. Nowadays, the employees they don't stay for so long. Ma'am, every dentist faces this issue that they have to hire frequently. They are not able to get the right employees. Ma'am, what is the actually driving the employees to stay with you for so long, and how is the salary given to them? How is the hike given to them, ma'am?
uh, actually, what happens is, the same thing which happens to your patients, same thing with
Ah,
the employees. They should have that friendly environment. They should have that
mm,
confidence in you
mm,
that whatever best treatment they would get anywhere else as an
mm.
employer, same thing will be given to nothing better than what we are giving them will be given to them anywhere else. Like whatever they
Okay.
are getting is the best. See,
Hmm,
suppose the
hmm,
patient,
hmm.
the this thing associate or chairside assistant asks for a pay hike,
Huh.
then you should be reasonably giving them the pay hike every year. I generally
Hmm,
do it
hmm.
around 8 to 10% every year is a pay hike.
Okay. Okay.
See why if your fellow dentist is giving them suppose 10,000 rupees for 6 hours practice, you
Huh.
give them 11,000 rupees,
Ah.
1,000 extra. But what happens is they will never leave you. Why? Because
Hmm.
see, why pay the person will leave you either he is not happy monetarily or he is not
Hmm.
happy with the environment.
Hmm.
If your assistants are leaving your clinic and you have to hire them frequently,
Hmm.
introspect where I'm going wrong, whether I'm
Hmm.
giving them less money for the work they're doing or the environment around is not right. The
Hmm.
most important thing of having your the associates or assistants for longer time is you don't have to teach them again and again. See, every six
Yes.
months, if the receptionist goes and you have to hire a new receptionist, half the energy goes in teaching them.
Ha. Ha. Ha, ma'am. So
It
true.
is the 1,000 rupees you spend, 1,000 rupees you spend extra is more beneficial than having a receptionist every 6 months. And
Hmm. Hmm.
they
Hmm.
once you have the person working with you for next 4 years, 5 years, they become loyal to you. The way you get used
Hmm.
to them, they also get used to you. Generally, those first 2-3 years, 1 year of your employee coming to you, new person, is very crucial. एक बार
Okay.
1 साल 1.5 साल बढ़ रहा है ना तो generally it is long term relation. They are
Relation.
also
Ma'am,
used to the environment. They also don't want to change the job.
correct. And
Why
आपके
would
यहाँ मैम
somebody
ये
change the job if he is happy?
यस यस सो ट्रू मैम एंड आपके यहाँ वी हैव सीन दैट टेंडेंसी दैट मेरे जैसे हम लोग जो भी ज्वाइन हुए हैं वी हैव गॉट मैरिड एंड देन शिफ्टेड वी हैव नेवर लेफ्ट द जॉब हम लोग की शादी
Exactly.
होके हम लोग गए हैं
Yeah.
बट अदर देन दैट हमें कभी वो थॉट भी नहीं आया टू लीव द क्लिनिक maybe as you said the kind
Hmm.
of environment which we have the how you treat us ma'am that is also important the kind of
Hmm.
exposure we get हमें सब चीजों से it's a
Now
package
that
it's
you
not
have
only
taken
salary.
up the topic, now that you have taken up the topic, I see that nowadays the older dentists, like the senior dentists who are employing their associates, they're actually exploiting them.
Yes,
Many a
ma'am.
clinics I have seen that associate dentist is getting less paid as compared to the chairside assistants. That is what is
Yeah.
happening. On
Yes.
this platform, I would like to urge to all these senior dentists that remember your old days and see how you could help the newer generation.
Hmm.
See, if the new generation doesn't come out knowledgeable, confident, then it is problematic to the society.
Hmm.
Suppose tomorrow I fall sick, I have a dental problem, and if the
Ah,
new generation, entire new generation of the dentist is incompetent, what will happen to me, my family?
correct. Correct,
So the
ma'am.
newer generation has to be more competent than the older generation. They have to be
Yes,
more
ma'am.
knowledgeable. And it is our responsibility as senior dentists to see to it that the next generation is confident and they are paid well.
Yes,
So this will
yes.
see like how you have in a joint family. सास ने बहू को मेरे सास ने मुझे ठीक से
जैसे ट्रे
she did not treat me well. So I am
हाँ,
not treating my daughter-in-law well, and my daughter-in-law is not treating her daughter-in-law well.
it's a vicious circle which goes on.
Similar thing should not happen in dentistry. It should not. See, if
Yes.
I pay my associate well, when my associate hires an associate, when he becomes a senior or she becomes a senior dentist, they will remember, अरे अपने मैडम ने तो ऐसे नहीं किया था.
Ah, that's so true, ma'am.
Somebody has to. They see what I know. My fellow dentists tell me that this is the trend, but somebody
Ah,
has to change the trend.
yes, yes, ma'am. And
Somebody has
we
to
will be the
change the
change. We
trend.
have
If
to be
it
the
is
change.
wrong, so why not you? Why somebody else
Yes.
has to change? You why not? Why don't you change? So
Yes.
I always say that the confidence built up is very much necessary. You have to teach the next generation whatever is right or wrong. And as I see for from so many years, it is many a things are inculcated in the new associates and they carry forward the same thing. Whatever good
Hmm.
thing they find, they will keep it with them and it will be carried in their own clinics. So
Hmm.
one good point, and it will be helpful for so many patients in
Hmm.
a
Hmm.
way.
Hmm. 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 Hmm.
So it
Because
is
they are actually
responsibility of
working for
us
us.
senior dentists.
Yes, yes, ma'am. Because
Yeah,
when
yeah.
when I hired for my clinic, they are working for us. So we used to give them a cut of whatever profit I
It
am
is
getting.
win-win situation.
Yes, ma'am.
It
It's
is
a win-win
win-win
situation.
situation.
Because if they don't see that
They also
that they are
need
not
you and
increasing
you
my
also
pay,
need them.
yes, yes, ma'am. And that helps actually whenever we fall sick or we have some issues. We
Exactly.
can't come to the clinic for XYZ reasons. They are there to help out and they'll do more to help out than what is required from them. So it
One
builds a
more
relationship.
important thing is they are the face. They are the face of your
Yes.
clinic.
Yes, ma'am.
They are the face of your clinic. You are the heart of the clinic, but they are the face of your clinic.
They are the
So
face of the
first thing
clinic.
is
That's so
their
true.
face. The receptionist is not interested in working, and she has that disinterested face. Then patient will come to you later. First one is the
Ah,
receptionist who's receiving them. So they
yes.
are the face. Your associate chairside assistant is not very caring types. Then
Hmm.
it makes a difference whether you are treated a simple suction holding. If the assistant chairside assistant is not attentive, it is
Ah,
so uncomfortable to the patient.
correct, correct, ma'am,
So keep
correct.
them happy, and they will keep you also happy in turn.
Ah, correct, ma'am. So in
Give
fact,
them
the
slightly more pay than a reasonable thing.
yes, yes, ma'am. And
It
to
is
get a good
slightly more.
hire, yes, to get a good hire, we need to give something also. It's not that everybody is looking for deals because of this Amazon and everything. Everybody is looking for
Hmm.
deals, like
Of course,
good
of course.
employment, but at a no, less salary. But that doesn't work out for a long term. We need to
No,
have
that
give
doesn't
them
work.
good salary, give them
Doesn't
a
work.
good
They
culture,
also
give
have
them
a family.
respect, give them respect that they require as a
That
human
is
being.
very important. Very important. Never shouted on your associate or your or assistant in front of your patients. Never
They
shouted
lose.
shouted them. Even if they have made a mistake, tell them afterwards. Tell them
Yes,
afterwards.
yes. They
Till
also
they know
have some
that you are
self-respect.
respected
They,
here.
yeah, yes, ma'am, that's so true.